As a patient, when you find out you have cardiovascular disease, your first step after you've seen the doctor is to come in and see one of our pre-op education nurses. They will go over the process with you. They will show you a video, they will show you a book, they will show you the intensive care unit you're going to be staying in post-operatively. They will show you the waiting room that the visitors will be waiting in. You will get all of your pre-op diagnostics done, and you will expect to come back 2 to 7 days later for your surgery itself. When you come in for your surgery, you're usually admitted to the 4th floor, where you will get ready for the surgery by taking a shower, getting changed, and then waiting for the pre-op nurses to come pick you up. Once they pick you up, you'll go downstairs and sit in pre-op with your family waiting to go to surgery. The surgical nurses you will probably not see unless they interview you in pre-op. After surgery, the surgeon will go and talk to your family in the waiting room. In about an hour after that, you'll be able to go see your family member in the intensive care unit. The recovery nurses spend a lot of time with the patient right after surgery and for the next 24 hours. It is a low nurse-patient ratio. They are at the bedside almost constantly. If they're not at the bedside, they are at the door. It is very intensive and very concentrated care. The nurses there are very, very well trained in how to take care of the cardiovascular patient. Once you transfer upstairs, your care is more geared towards going home, getting up and moving, doing your coughing and deep breathing. The nurses are very conscientious about your educational needs so that you will not become a repeat patient over and over again. They are compassionate, consistent, empathetic, well-trained nurses. The accolades that we have gotten over the last 15 years have pushed us to become better nurses. Our patient population has changed in the last 10 to 15 years. They've gotten older, they're sicker, so we've had to come up with new ways to get them well. Something that we've just done in the last year is we've developed a quiet time. So when they get to the step-down unit, the day after they get there, there is nothing we are going to do with them between 2 and 4 o'clock in the afternoon except promote them taking a nap and getting some rest so that they can get up later in the afternoon and do their walking and coughing and deep breathing like they're supposed to. The patients now are 5 to 7 years older than they were 20 years ago, and we found that it made them happier. It made them more compliant with their post-operative requirements. And it made the staff happier, so it's been a win-win situation for all. I came to Munroe 20 years ago because I wanted to work at a not-for-profit hospital. I've worked at for-profit hospitals and not-for-profits, and I find that the attitudes towards the patients is quite different, and the attitudes towards the staff is quite different. The not-for-profit hospitals tend to be pro-staff, pro-advancement, and pro-patient safety and care. And Munroe has provided that for me.